Good morning everyone and welcome to today's WorkSafe Tasmania Month webinar. I'm Stephanie from WorkSafe Tasmania and also the coordinator of WorkSafe Tasmania Month. I'll also be your moderator for this morning's session. Before we do start though, I'd appreciate you taking a few moments to read the following slide about information received during WorkSafe Month webinars.
Thanks, Stephanie, and good morning to all. I'd also like to take this opportunity to thank WorkSafe to provide this presentation during WorkSafe Month and welcome all webinar participants. Just a quick background, AusHelp Tasmania was set up 8 years ago to reduce suicide and build the resilience of workers and managers specifically within the Tasmanian building and construction industry, with stats from their super fund CBUS indicating that in 2007 the industry was losing on average about 10 workers a year from suicide, drugs and alcohol and unknown causes. Since then the foundation's reduced the number of deaths by over 80% and expanded into a wide range of industry sectors including TAF, mining, hospitality, transportation, working with the government sector, the not-for-profit sector, including companies such as Hydro and NiStar. Through our work and external evaluation by UTAS, we recognised that the prevention activities that we were undertaking were a key component not just for reducing suicide but actually focusing on the mental health and well-being of workforces. In particular, it was about building the resilience of all members of a workforce by providing awareness, knowledge and practical tools around mental health and well-being. With this, the objective is to provide knowledge and skills for individuals to understand and look after their own mental health and support others that may have mental health problems. As highlighted by the number of participants that have logged on, there's a growing awareness that mental health and well-being is becoming a significant factor, not just in the community but specifically for workplaces, and they need to consider that from both a work health and safety perspective and an employee engagement perspective. I can't guarantee that this presentation will have all the answers that you may be looking for, but hopefully it will provide an insight into workplace mental health and well-being, what can be undertaken to support good mental health and well-being in the workplace, and any issues that may actually arise. That's right, I'm just trying to move to the next slide. I might just get Stephanie and see if she can move to the next slide for me. This presentation is going to look at three particular issues. First of all, I want to provide a common understanding of what mental health and well-being is, the benefits of mental health and well-being policy and program for the workplace, and then some practical workplace training and activities that workplaces can actually put into place. Whilst it may be counterintuitive, work is actually fundamental to a person's good mental health and well-being. And I say counterintuitive because we often relate to mental health in a negative context, rather than actually focusing that the concept of mental health is actually a positive one and refers to getting the most out of life. And in this regard, work should bring with it a sense of belonging, and that is they're part of, an individual is part of something bigger than just oneself. It brings with it a sense of purpose, in fact, that they're actually making a difference, and a sense of being connected to the wider world and the ability to keep learning. In this regard, if you look at it from that way, we actually want to go to work, and work is actually good for us. And there's probably a few people figuring out there at the moment going, yeah, maybe. However, if work is not fulfilling these needs, then the effect on the workplace can include increased absenteeism and presenteeism, increased work turnover, poor work performance, and increased accidents. And so from this perspective, implementing a good mental health and wellbeing program in the workplace can have significant benefits for both employers and employees. On the screen now, you'll have a list of benefits from both an employer and employee perspective. In particular, for looking at the employer side, one of the things that is cropping up and evidence is now showing that stress at work is actually on the high on a increase, with a lot of claims and absences away from work being related to stress. So by giving people the tools to actually look after their own mental health and be able to reduce stress, can actually then reduce being absent from work. And also a reduction in accidents. It seems counterintuitive as well, but if we actually look at what causes most accidents, it's really often a matter of inattention. In other words, the person's mind is not on what they're actually doing, it's somewhere else. They're worrying about other things than the actual task at hand. And so actually just by putting some mental health and wellbeing programs in that actually help people look after their health and wellbeing, they can then focus and concentrate on those things at work and actually help reduce those accidents. From an employee perspective, I guess one of the best ones, that even though that's not actually physically on the list, is that an employee who enjoys their workplace, has a healthy workplace, speaks positively about the workplace. And so that in terms of promotion and the image of that company, because they are healthy, they are well, they enjoy going to work, then there's a positive flow-on effect from that as well. Before I go much further, I just want to do a quick distinction between mental health and mental illness. And what I mean by this, I want to draw on the positive concept of mental health, which will then set the framework for further down the track as we go through the presentation. This slide is not meant to be definitive. It's designed to be a reflection of two linked but differing circumstances. Mental health is a holistic description of both social and emotional well-being, and it's more than just the absence of an illness or a disorder. And sometimes we often hear people saying, well, if I don't have depression and I don't have anxiety, then I must have good mental health because I don't have a mental illness. But the two are actually separated by the fact that it's mental health and well-being is from a social and emotional context. And in this regard, a poor mental health can affect an individual's contribution to the community through the capacity to work productively and to interact and inclusively and equitably with other groups and individuals. Conversely, mental illness is generally viewed as a term that refers to a diagnosable health disorder or condition, and they're often characterized by alterations in thinking and mood or behaviors. Often we will also hear about mental health problems or mental ill health, and all these terms are often used interchangeably, and there are differing opinions even at a professional level about actually how they're used. Notwithstanding this presentation is about looking at mental health and mental illness, so it'll actually take into consideration both sets of circumstances. This slide focuses on the mental health concept, and as you can see on the slide, there are four spheres. The physical refers to the health of the body, which we're all pretty familiar with. Emotional refers to our emotional feelings, for example, love, happiness, fear, sadness, shame, surprise. The mental aspect refers to our thoughts, our cognitive abilities, our beliefs, our goals, and our values. And the spiritual component provides the underlying inspiration and motivation for one's life. It's about what we believe in. It's our sense of being, about who we are and why we're actually here. And all these factors are shaped and operate within external environments in which we live, socialise and work. From a positive mental health concept, the idea is to keep these in relative balance, recognising that this is not always possible. For instance, if you're injured, then your physical health is going to be impacted, but also your mental and emotional spheres are going to be impacted as well. You're feeling a frustration because you can't go out and exercise, or becoming short-tempered. But at the end of the day, the injury will heal and we'll be able to get back to a better balance. And I'll look at these from a workplace perspective shortly. Looking at mental illnesses, as I mentioned before, mental illnesses are generally viewed as a term that collectively refers to a diagnosable health disorder or condition, and they are often characterised by alterations in thinking, mood, behaviours, mood or behaviours associated with distress or impaired functioning. And mental illnesses fall into several categories as listed, and some will be more aware of than others, such as depression and bipolar, where there is much wider community discussion. As highlighted earlier, mental illnesses are a diagnosed medical condition, and they relate predominantly to a chemical imbalance of the brain. But there are a couple of key things I'd like you to remember from a workplace perspective. People with a mental illness can, and they do live and lead productive lives with the right medication, support networks and adjustments. And I guess one of the key messages I want to get across is, as we would accommodate somebody in the workplace that had diabetes or a broken leg, we can and must do the same for those with a mental illness. And creating a healthy, mentally healthy workplace can help you achieve this. It should also be noted that just as those without a mental illness, work provides with it a sense of belonging and a sense of being connected to the wider community and the ability to keep learning. Just from a contrasting perspective, mental health and mental illnesses are on a separate axis, and we often get this confused. We think because we don't have a mental illness, and so if we go to the right-hand side of the scale, if we don't have mental illness, then we must have good mental health. But you can still have no mental illness and still have poor mental health if you can't do those activities that actually help look after those spheres that you're actually trying to keep. The physical side, the mental side, the emotional side, if they aren't being connected to, then you can still have no mental illness and poor mental health. Conversely, somebody that has severe mental illness can, as I mentioned before, can have really good mental health if they have the right medications, the right support networks, the right frameworks around them, and work can provide one of those characteristics or one of those activities that she supports them having good mental health. This slide also is not meant to be definitive, but it's to give you an example of how we might look at a person that may be having a mental health or a mental illness issue. Now, as a layperson with no medical training, we can't make the distinction. But from a work health and safety perspective, there's a duty of care to look after yourself and to look after others. The red line is basically mental health. If you see people that are expressing or showing some of those items that are in the red side, such as being worried or anxious, having sleep problems, poor concentration, there may be a mental health issue coming into place, where conversely, on the green side, if they're excessive worry or fears, or increased or decreased sleep problems, or potentially increase in drug use, then that may be a trigger to say there may be a mental illness. It's not about making a diagnosis, but it's because you've seen things that are happening and changing, it's probably an appropriate time to inquire why an individual may be displaying those characteristics. And one of the things that I'll cover towards the end is some of the training programs that the Foundation has in place that actually helps you have that conversation, especially by managers and supervisors, to talk to their staff. We'll now have a look at how mental health fits into the workplace at an individual and organisational level. At an individual level, we have to remember that people generally want to come to work and they want to achieve something and they want to make a difference. And at an individual level, you can create and fulfill mental health concerns by considering some of the list, considering the items that are actually on this list. If we look at a couple of them, staying connected, uh, the ability to connect on a social basis outside of just their home sphere and their private spheres is actually part of actually coming to work, and we all often like to have that quick chat and find out what happened on the weekend. So actually giving people the time and a space to actually talk for 10 or 15 minutes at the start of a working week actually helps them feel connected. It gets the things that are happening in their life shared with other people. Similarly, the access to supervision. A lot of us have an open door policy and that anybody can come in and see us whenever they like. Unfortunately, when they do come to the door, they look inside and the person inside that door is either very busy or is tied up with something else or is on the phone. So even though you have the policy in place, it's not just about having the door open, but actually also making the time and space. And a real simple one is the workspace itself, and it could be just the size of the desk or having a new bookshelf, or as simple as painting a room. If you think about what we do in our own home life, we actually like, when we paint a room or paint our house, we go, you actually feel really good and you go, that's really nice. So a coat of paint can actually have a really good impact on good mental health and well-being for an individual. At the organisational level, I've broken it across the four spheres: the physical, the emotional, the mental, and the spiritual. Again, it's about doing some things that actually can be done easily. Look at the physical side, limited cost but easy to implement, such as I've mentioned before, a coat of paint, a bigger desk, new lights, and believe it or not, a heater. One of the coldest places is Tasmania, yet often a lot of workplaces don't have heaters in them. That emotional sense is about a sense of control about how they do their job, and then also watching their overtime, watching the amount of toil they're actually building up. And we have to be, if we're honest with ourselves, we all actually tend to accrue far too much time in lieu or not taking sufficient leave. But that then has an emotional impact on how they're actually conducting themselves at work. From a mental perspective, again, it's about supervisors connecting with their employees, and while you might have the open door policy, it might be actually just switching that policy around and saying, instead of always getting the employee to go to the supervisor when things are going wrong, the supervisor or manager actually coming out of their office and going into the employee space and taking the time to actually chat to them. And at a spiritual level, it's about how they're making a difference. Everyone wants to go to work and make a difference, but sometimes we don't often get that appreciation that we are making a difference. And so if they're engaged and connected and they feel like they're making a difference, they're part of a bigger whole, then that is a positive reinforcement that the workplace is actually making a difference to them. What we're going to look at now is actually how do we make this happen. We've broken it down at the foundation into 3 levels: promotion, prevention, and early intervention. The key here, there has to be a commitment from the workplace and a combined commitment to actually make it change, but also it's also got to be resourced as well. Whilst we would recommend that organisations put in place a strategy and a policy for which OzHelp can actually help and support with, you can actually implement and put these things in place on an individual basis over a longer period of time. We would recommend highlighting them progressively. So you may start with promotion activities initially, then move to prevention, and then move to early intervention. But they should be developed as a package. They don't have to be all done at once. And for some companies that we're working with, it's actually over a whole year period. So it's not something you have to make and happen. And by doing it over a longer period, it also shows a commitment to actually to change. And you have to remember, change, especially on a mental health perspective, is not going to happen overnight. Let's look now at promotion. Promotion in the workplace is designed to raise good mental health and well-being in the workplace by raising awareness and raising understanding, dispelling those myths and barriers around that word and the term mental, and then understanding what relevant workplace policies and procedures are actually in place. Many of the things that you can get to raise awareness are actually at no cost as well. They can be sourced from free from AusHelp or from Beyond Blue through their Heads Up Work program, through the Black Dog Institute, and through Sane Australia as some examples. So it's not about, it doesn't have to be an expensive activity. It's all about just raising that promotion in the workplace, about saying, here's some information people can actually have a look at, and then they can actually look forward and research stuff themselves. Activities, the development of workplace health and wellbeing policies, and that's often the hardest one, but it's about incorporating a mental health and wellbeing policy within your current work health and safety environment, not creating something new and separate. Putting out posters in the workplace on mental health and wellbeing issues, leaflets, articles, as I mentioned before, but you can also look broader than just mental health topics. Things like postnatal depression or sleeping problems, stress, things that actually affect mental health as a whole. So it's not just necessarily focusing on mental illnesses such as depression or anxiety. It can be much broader. On-site toolbox meetings, you can get somebody to come in for those 30-minute meetings and just give 5 or 10 minutes on specific topics or issues. Or if it's a bigger company, then you can have things on your intranet page that provides information on mental health and well-being. Moving now to prevention activities. Prevention activities are designed to support the health and well-being in the workplace by providing practical skills and tools for people to look after themselves and for people to look after others. It's designed to increase alertness to mental health issues and reinforce policies and procedures and understanding of the well-being and work-life balance. Some of the activities you can do are actually national or state activities, so we recommend that companies look at doing things that include like Movember or Are You OK Day, and they can be embraced at an individual or a work section level or at a corporate level. Other activities that you could put in place include running training. Now, the training that the foundation runs focuses on 2 levels. It focuses on individual level to actually increase an individual's knowledge about what good mental health is and how to look after themselves. And it also reinforces a 2-way responsibility, and that is, while an employer must provide a safe workplace, individuals and the workers themselves have a responsibility to present themselves in a positive physical and mental state ready for work. And so at the individual level, it's about providing the skills and knowledge to workers so they can actually look after and put in place their own mental health and wellbeing programs. Secondly, we then move on to a supported program which is called Connecting, and that's about looking after or supporting other people in the workplace that may either have a mental illness or may actually have a mental health issue. And the third lot of training is then designed for managers and supervisors to enable them to either manage somebody who's having a mental health and wellbeing issue or provide the tools or the linkages to, and I'll talk a little bit more about that later in one of the tools that we use to support and provide to people to actually look after others in the workplace and support others in the workplace. Moving on to early intervention. Early intervention is about preventing small issues becoming complex or critical. We want to try and get in there before they get to a crisis point, so that the impacts are both limited for the individual and for the organisation, and the impacts can be minimised. And again, this sort of becomes a duty of care as well. Whilst individuals have a duty to care to look after themselves and put in place early interventions, early interventions can also be supported by co-workers if they have the tools to reach out with a genuine understanding, and that's about providing that right information about what good mental health and wellbeing actually is. Activities that can be undertaken to support early intervention: manager and supervisor training, providing support networks for supervisors, and often this boils down to most people want to help, and they're keen to help, but from a mental health and wellbeing perspective, they don't have that knowledge or experience to be able to talk and feel like they take on somebody else's difficulties or issues that are relating around mental health or mental illness. So in terms of actually providing training and tools for supervisors, it's incredibly important. And one of the tools which I'll just go through shortly is the SALT tool, the ability for people to see what's going on, ask questions, listen to the answers, and then link that person to support. For bigger organisations, the external assistant providers, or the EAPs, provide a good mechanism for employees to be able to link to a group and disclose the issues that are going on that's confidential. Also, workplace visits or presentations by community organisations to raise awareness. The key here, often it's not all, while we're talking about managers and supervisors and providing the support networks for that early intervention, often the first person to see something that's going wrong in somebody's life is at that worker level, because they're with them on a more day-to-day and more connected on a day-to-day basis. And that's where the changes are often seen first. So that's why I think it's important to give your workforce or the workers those tools, not only to look after their own mental health and well-being, but when they can identify and see somebody who is struggling, give them the tools to be able to engage, and it might then be they then refer them to the supervisors. In this regard, I just wanted to spend a little bit of time on the SALT tool, and this is one of the tools that we provide both to workers and to managers with some practical activities in them. We often see when somebody's having difficulty, we know when they're not feeling well, they're not looking well, they might be absent, they might not be turning up to work on time, they're talking about things going on in their life, the difficulties with kids. So we know things are going on, and often we're going, yes, we want to help, and we might ask the question, but we ask the question and we go, are you okay? And they just say yes. So it's about framing up new questions for them to ask. It's about thinking about, I've noticed or I've seen, and when you do that, when an individual does that, they're then showing that not only they've got some empathy, but they're actually seeing and noticing something about that person. And that, just by having that conversation, can then open up to that person saying, yeah, actually I might want to talk. The difficulty then often happens is that somebody might start talking, and what we're doing is we're hearing what they're saying, but we're not listening to them. Or at the same time as we're listening to them, we're trying to solve their problems. And often when people are having mental health or mental illness difficulties, they just actually want somebody to listen to them and actually hear what they're saying, not necessarily provide all the solutions for them. And then the fourth step is about how then do I connect that person to the best possible support. Sometimes people have their tools to be able to, they've been through those same difficulties or same issues, so they're actually able to provide the assistance that's required. But often, so they can, and that's why we have the tell and the take there, so someone could tell them, here's some things you could think about, and have had training in mental health and wellbeing, they've got some of the tools that they can pass on to them. Or if it's beyond their scope to be able to deal with or to handle, it's about taking them or linking them to somebody that actually can actually make that difference. And it might just be saying, you need to talk to your doctor, or you need to talk to the supervisor, or have you thought about calling the EAP? So that's a brief overview of the SALT tool or model, and for training that we run in the workplace. When you do the full program, it goes into a lot more depth. The key though here is, and the key principle of the SALT is to identify early and to link somebody who may be struggling to somebody who can actually provide them support. Just a quick overview of the programs that the Foundation is currently running in workplaces. The introduction to mental health and wellbeing, as I mentioned a little bit earlier, it's about introducing good mental health and the positive concept of mental health to individuals in the workplace. And in the handouts, which I think you can link to from the webinar, and they'll also be on the WorkSafe website, there's an overview of all the programs that I'm listing there. But the introduction is really at the individual level. It's about giving those tools and skills for individuals to look after and manage their own mental health and well-being. At the connecting level, it's about them spreading that knowledge and information that they have, but everyone in the workplace feeling safe and confident that if they had a mental health issue, or even if it was just a minor one, that they could actually talk to somebody about it and get the support they actually need to move through. And as I was talking before, it's exactly the same as if somebody was a diabetic and you provide the right tools and the knowledge for the co-workers to support that person, or somebody has a broken leg or a broken arm. It's about providing those support for that sort of person. This is doing it from a mental health and wellbeing perspective. The third program there is actually managing mental health and wellbeing in the workplace. And this has been specifically designed for managers and supervisors. What we were finding is that a lot of managers and supervisors were struggling differentiating between a performance management issue and a mental health issue. And so what might be identified as poor work performance, when they were drilling down to find out what might be causing that poor work performance, there are often issues that might have been related to stress or anxiety or relationship issues or other issues going on in a person's life, but the supervisors weren't confident and didn't have the tools to be able to support or help that person work through those by either dismissing them or saying, I can't help you here, you need to get some help and go see your doctor or go see an EAP. Yes, those are good functions and those are things that people should be doing, but they also need to be able to discuss those in the workplace, because other people are also going to be noticing that things are going wrong and they're going to need support to move through those issues that are going on. What we've designed is a tool that actually takes a leap or move out of that performance management issue, pushes it out into a side space, look at a person's mental health and well-being, putting those right things in place that need to be put in place to connect a person to get the right supports, and then bring them back into the workplace, and if they need to, go back into performance management again. But often we find once they've dealt with those issues, especially the mental health and well-being ones, a person is able to move on productively, reasonably quickly for a mental health issue, perhaps a little bit slower for a mental illness issue. The tool also gives the managing mental health and wellbeing for the supervisors and managers. It's also about providing the tools to actually have that conversation and broaden from just actually asking, are you okay? Yes, it does use a little bit of the SALT in there, but it takes it a little bit step further, and we actually give the people practice in actually asking and answering those questions, because we're often fearful of when we ask the question and then we get a issue, do we actually have to solve it, and how do we actually solve it? And what we're saying to supervisors and managers is that you don't actually have to do and solve the problem. You have to recognise that if it's outside your scope, it's about then linking them to the right support mechanisms that can then support them moving forward. The last program that we run it's also under the umbrella of SALT, but it's actually a specifically designed suicide awareness program, and it's something I think that a lot of workplaces are taking cognizance of now. Suicide has certainly become an area in society with raised awareness, and some workplaces that we have worked with and for recognise that when people have been impacted by suicide, whether it's through friends or relatives or in their social circles, that actually it can have quite a significant impact on their health and well-being, and also then a significant impact on an actual workplace as well. So the awareness is about creating awareness and some tools to actually just look at, and if somebody is struggling or having difficulties, then there's a tool in there which actually helps them connect people to the adequate supports that they might actually need. That actually ends my formal part of the presentation and showing of the slides. Once again, I'd like to thank WorkSafe, and we're happy to be asked any questions, and I'll hand over to Stephanie.
All right, thank you very much, Doug. So as Doug said, or as Doug mentioned, there are handouts with today's webinar. So if you do get the chance to download them before the webinar ends today, certainly do so. Otherwise, we will certainly send those handouts out to the individuals who attended this morning's webinar. So thank you, Doug, for your presentation supporting mental health and wellbeing in the workplace. So now if anyone does have any questions for Doug, certainly please do submit those questions into the questions pane in your control panel. One question that has come through, Doug, is it possible to get a copy of your presentation?
Yes, it is. If they actually send me an email, and my email address is on the should be on your screen at the moment,
Yes,
then
yes.
yep, I'm more than happy to send that presentation out.
Okay, so if anyone does want a copy of Doug's presentation today, please do email Doug on the email address there. Question, Doug, is AusHelp in Victoria?
No, it's not. Unfortunately, it's not a national organisation as such. We do have offices, well, the offices in Canberra, Northern Territory, and Western Australia, but not in Victoria.
Okay, thank you. So if anyone does have any questions, again, please do submit them into the questions pane. Just also, while I do have everyone online still, as I mentioned, well, from what people didn't probably hear at the start, WorkSafe Month does end on Friday, so we are still running webinars, one again this afternoon, two tomorrow, and the final one on Thursday. Then to end WorkSafe Month this year, we have the Ronald Young Rivulet run. So do have a look in the WorkSafe Month program for that final event on Friday. And for the other webinars, please do head straight to the WorkSafe TAS website, either download a copy of the events program or head straight to the registration calendar and register for any of the other webinars that we do have running. So Doug, to end today's webinar, I'll just remind people that we are recording webinars during WorkSafe Month, so if you would like to listen to any of the other presentations that we have run during WorkSafe month. If you didn't get a chance to hook into them at the scheduled time, please do head to the WorkSafe website after WorkSafe month. We'll, as I said, progressively get those webinars up onto the site after WorkSafe month ends. And again, if you can look out for the short survey that will pop up on your screen once this webinar is closed down, do let us know about your webinar experience and also your thoughts on today's presentation. So, on behalf of WorkSafe Tasmania, our presenter today, Doug Fortier from AusHelp, we certainly do thank Doug for his presentation supporting mental health and wellbeing in the workplace. We also thank you for joining us today, and we hope that you have a safe and healthy rest of the day. Thank you, and thank you, Doug.